Good evening, one and all. Today we're talking about COVID-19 post recovery, physiotherapy management, and its importance. Here we are, along with Healthify, Bhimavaram Physiotherapy Clinic team, representing this program. Our team includes Dr. Ravi Babu, MPT Ortho, head physiotherapist, myself, Dr. Sandeep, and Dr. Ramya Bhavani. The brief introduction. As per India currently is facing the second wave of COVID-19 infection, it's been observed that the pathogenicity of current viral strain is increased. Consequently, India is seeing an increased mortality rate and post-recovery issue. Patients who are recovered from the COVID-19 infection continue to experience the disease even after like 4 weeks after the initial recovery. Few of them expect like post-COVID complications, that is referred as a long COVID or long haul COVID. Since COVID-19 infection can affect the vital health in long run, so we need a proper exercise regime. That means which includes a physiotherapy and balanced diet and psychological support. It should continue. As for the physiotherapy aspect, the recent studies have taken some journals support. This is one of them. 6 months consequence of COVID-19 patients. What they have, what they found is fatigue or the muscle weakness, almost like 63 percentage. Pain or discomfort, where joint pains, muscular pains, neurological pains, around 27 percentage. Anxiety or depression, that's around 23 percentage. And other studies like rehabilitation post COVID-19, cross sectional observation using Stanford Hall remote assessment tool. They also found these, which I think is almost 70 percentage almost. And you can see that. And almost another main thing is pain, the memory or the cognitive issues is 20 percentage, and so on. This is taken like post recovery, like the symptoms occurred 13 weeks after the COVID issues. And key message in this is even the patients suffer the post-COVID symptoms, even it is very, even the illness is very less. This is the key message. And patients suffering from the COVID-19, regardless whatever the age or whatever the issues having, most of the people have COVID-19 post issues like majorly muscle weakness or the cognitive issues or the pain issues or the breathing issues like shortness of breath or any other lung issues. Another study says, research article, functional outcomes in inpatient rehabilitation setup. In this, rehabilitation has been done for the post-COVID discharged patients who have been recovered from the COVID-19. So in these people, they found most of them is the cognition, balance, gait speed, and in this, most of the thing in cognition around attention issue, 37 percentage, memory 28 percentage, problem solving 28 percentage, balance around 55%, and gait speed around 97% percentage they have found. So in conclusion, they said it, the rehabilitation in these issues which post COVID-19 has done or the problems they have occurred, so giving them a proper rehab. In this study, they have done 2 to 3 weeks of rehab, in the sense giving them cognitive skill training, balance training, muscular strength developing according to the protocols. So in that, they have found significant improvement. In this article, uh, basically for the mainly for physiotherapy management in COVID-19, they have done and they found the main impairments which are highlighted: muscle weakness, range of motion problem in the upper limbs, and edema, pain and discomfort, breathlessness, and cognitive impairments. So that's why I planned like this, making a post-corona like a physiotherapy rehab, which I've highlighted as muscle weakness is the most one, breathing issues, cognitive problems, and pain, maybe joint pains, muscle pains, anything it could be. So for the muscle weakness, how we plan, and breathing issues, how what the physiotherapy management, and cognitive problems, and for the pain. So we can talk in detail. For the muscle weakness, it's not like generally giving them strengthening totally. as a normal person, but we assess them according to their exercise tolerance, like how much they can do the exercise. Maybe according to the age or the severity of the disease they had gone through. So we just keep very simple, give them range of motion exercise in the sense not to like any joint should not get tightened or stiff. Secondly, we give strength developing and balance training, and we prescribe exercise for the home program, how many times to be repeated, and accordingly we plan the program for the muscle strengthening. So these are the general pictures I put in. It's like shoulder shrugging, how you do it, and then rotations, ankle movements, knee lifts, sit and stand, shoulder rotations. These are simple exercises. And strengthening is like which we do with dumbbells or sandbags, or even if you don't do anything without anything, you can use a water bottle, a half-liter bottle, or like 200 ml bottle, put a water in it, or you can use sand in it, and you can just do number of repetitions as prescribed. And this is a scale for a breathlessness scale, which we use during the exercise, before exercise. Before exercise, you see how much you are, how do you feel. It's like for the common person, anybody can say it's a self scale. So 0 to 1, which I put as a blue one, is very minimal, and the green one is slight to somewhat, little bit moderate, and you go to the orange and red, pink or something, that will be little severe. So our goal is to reach till a 3 to 4 level, not more than that. So according to the exercise we give, also you should not feel more than that. So you should do in the moderate level. These are the simple breathing relaxation positions. Now we're going to the second topic. Second one is the breathing issues. People who's having breathing issues, like when you work or when you walk or when you do exercise, if you feel any discomfort, this is the relaxation positions which you can use at the place where you do exercise or you take walking or you go outside. These are the simple positions to just to give relax, not the breathing exercises. These are the relaxation positions. This is the breathing exercise which you should do. These are not like very vigorous breathing exercises we prescribe. We give it very mild and very gentle exercises because we don't want to strain even the respiratory muscles, because those muscles also will be affected in the COVID-19 issues. So we should not strain them too much. So we give them very gentle exercise, which I have shown you in the picture. The pursued lip breathing, we take it gently through nose and leave through mouth very gently. As much as possible, you can breathe in and then relax slowly. So you can do for 2 to 3 times and then relax and continue the same. The second one is the breath rectangle. So like you can imagine a window which is in a rectangle position. So Sean, breathe in will be lesser time, longer time. So like that, you do it very gently and relax. You can watch the window and do it so that it will be easy. You don't feel any strain. The third one, incentive spirometry. That is, most people I think whoever using the medical thing, they would already aware of it. But the people who do not know, this it's available in surgicals or any medical store. It has 3 balls in it, which is like account depending on the pressure you blow, the ball rises up. Minimum at least 1 to 2 balls you should be able to uh, blow it out. In the sense, you put the mouthpiece in your mouth and then exhale, inhale. 2 types are there: upside down, and the straight way. So in that way, anybody can help you. This is one of the thing which is helpful in biofeedback. You will be knowing how much you are able to breathe out, how much you are able to take the air in. It's a simple exercise. Don't strain, but do it very simple. And the balloon exercises, which you all know, it's very simple. Gently you blow it, not so strainfully, but number of balloons, like which is simple one, you blow it, not very hard ones. Like, and another thing is the breathing control while walking. Breathe in with 1 step, as I said previously. Breathe out in 2 steps. The breathe out should be a little longer than the breathing. And the pranayam I put in because some people who likes yoga or they do pranayam exercises. This is the thing which you can do. You can do it very slowly in the manner which I've shown. And this is the ACPT technique for physiotherapy, which we use, very effective. This is for the people who are having secretions in the lungs. Say people are having still cough, because it says that even people who are recovered from the COVID-19, they still have cough for about 2 to 3 months, or some people having even 6 months. So these people who are having secretions in the lungs, they can follow this simple technique, which is something called the breathing control. Starts with that. That means relax yourself. You don't do any kind of exercise or anything. Just normal relaxed breathing as usual. Then you go to the deep breaths. Deep breaths that should not be very strainful, very slowly and deeply. Repeat 3 to 4 times. Simple deep breath 3 to 4 times. And after that will be followed by breathing control again, as shown in the arrow mark in the picture. After that again deep breath. Again after that will be breathing control, which I've told in the first one. Simple, gentle, relax, and normal breathing. And the last one will end with a huff or a cough. Huff in the giving. Imagine a mirror, something if you want to clean it, how you say do huff and then in that way you can bring your secretions out. Otherwise you can do a cough. If you are able to do, you can cough as much as possible. So repeat this 1 to 2 times. So how long you should be doing this? You can do comfortably according to your comfort. Do at least minimum 10 minutes. If you can do, go for 20 minutes. Like that you break it up and do for 3 times a day if possible. If not, 2 times is okay. This is our positions for your people having little more secretions and you're discharged. Maybe you're on oxygen therapy. If you're still on oxygen therapy, don't remove your oxygen. You can still have your oxygen and try to be in these positions which you can clear your lungs, the secretions which you're having. So that can ease your secretions out and bring you without, you can remove your oxygen as early as possible. This is the first position, the prone lying, in the sense you will be on lying on your belly. There's a picture I put it. You can use pillows in a comfortable manner. It should not be very discomfort. You should use it in a comfortable and come to the left side or right side. Anything is fine. One side of position for another 30 minutes and go to the upright position for another 30 minutes. And fourth one, you go to the other side. First, if you're on right side, go to the left. If you're on left, then go to the right. And then in the fifthly in the last, again come to the first position, which I've shown. In this way, you can bring your phlegm or the secretions into the trachea, bronchi, and then bring it through the trachea outside. You can cough it out. This is one easy technique for the bringing secretions outside. So now I'm going to the relaxation techniques. People who are having mostly after COVID-19 recovery, people are very anxious after the issue. They think too much, and psychologically they might be depressed. So this is the one simple techniques I've put in. So you can try this for decreasing your depression or anxiety. It's the same 5 things to do. Take a few slow breaths and ask yourself, what are the 5 things I can see? What are the 4 things I can feel? What are the 3 things I can hear? What are the two things that I can smell? What is one thing that I can taste? You can just answer this thing slowly, one at a time. At least 10 seconds you can spend and see what answer you're getting. So in that way you can divert your mind. Secondly, picture yourself somewhere in a calm area, like it could be a memory which you have been somewhere, you've been made up a place which you like, or the place you like most. Think about that and imagine yourself so that you will be diverting your mind. Thirdly, like close your eyes and think maybe what does it look like, what colors, what shapes you can see, what sounds you can hear. Like that, you can imagine yourself and relax your brain and come out of that psychological issues. And the third part which I'm talking, first I spoke about muscle weakness. Second one, I spoke about the breathing issues. The third one, I'm speaking about the cognitive skill training. This is like cognitive skills are nothing which only physiotherapy is not only the part. It's a complete, it's a multidisciplinary approach. Psychologists, psychiatrists, doctors, and physiotherapists, occupational therapists, a group of people, they do this issue. In this part, a little bit of cognitive skill training also, we do it. It's nothing but exercising the brain to think faster and learn easy. In this mostly, we concentrate on attention, the memory, and the problem solving. I put some examples like how we do executive functions. We ask them like we put some symbols and ask them to write a words in a star manner and point which we have done, and imagine those pictures which I've told. Put that ball in that basket, this thing, And the third one is like we give words and ask them to make a quotation out of it. The fourth one, we put this is a no, it's not colorful, but in a colorful way. It's like a child playing that in different distinct pegs. We keep all the pegs in order. So in that way, we give executive function. Second one, going the verbal memory. This is one part which I've shown the picture. We show these pictures in the words, and we ask them what do they remember, and who are you. Like this is the thing which we say. How do you which word memorize the word and their location on the grid, and also we put letters in different zigzag manner and ask them to make a word in it, and in that way we give them verbal memory. The visual memory, this is also a black and white, but the colorful we make it here and ask them to color what color they see, and what size they have, and where do they stay, and remember some kind of pictures. That's a visual memory, and it's like combining both verbal and visual memory. We ask them what's the destination. We first show them and we ask them the place, and we ask them a different destination they remember again. So in that way, we give them visual plus and verbal memory. So this is the type, and visual attention. You can see in the picture, there are different shapes are there. What's the different shape? Those both pictures will be same, but one is different. So ask them to find out which is different one. So odd one out. The visual attention we see, and the sound memory, and also we ask them what type of sound they heard. Like we make them a sound like mobile ringtone or message tone or email tone, something we make them remember them, this is the tone for this purpose. We ask them, we teach them first, and then later on we ask the sound memory how much they remember, what do they remember. In that way, this is a basic thing I put in according to the people's issue. Maybe their planning will not be good, their execution will not be good. So according to the cognitive issue they have, we train them so that they again retain their cognitive skills as much as possible. And for the pain management, I did not put in this, but for the pain issues, as a physiotherapy, we have different modalities. We can treat in for every pain issues which are related to that, and not internally metabolic issues, as muscular pain, neurological pain, and joint pains. We can treat them, give them specialized exercises, and also the physiotherapy treatment. The important things I would like to ask you to remember is people having any other like cardiac problems, heart issues, do not go for vigorous aerobic exercise like at least for 3 months. And make sure you have essential rest, and make sure you do a monitoring of oxygen levels. And people who have a previous history of any depression, demyelination, any neurological issues, or stroke, or any encephalitis, so make sure you consult a neurologist after your COVID-19 recovery. Thank you for watching. Any questions? I would like to take it.
అది కోవిడ్ లో
Like what you're telling, like simple
లో ఉన్న
exercise means
పేషెంట్స్ ఏవైనా ఫిజికల్ ఎక్సర్సైజెస్
there is a scale which I says breathlessness scale. You should not feel too much breathlessness. Like if you are okay, మీకు ఎంతవరకు చేయగలరో అంతవరకు వెళ్ళొచ్చు. Which I put a scale is 3 to 4. It's moderate to somewhat moderate. You should not go more than that.
ఓకే. మామూలుగా అట్లా ఏ టైప్ ఆఫ్ ఎక్సర్సైజెస్ చేస్తే బెటర్ అండి? యోగా ఆర్ అలాగా జిమ్?
It's purely different to the age. If they are young people and they are used to yoga, they can go to yoga according to the situation. In the sense, do not strain too much. Go in the minimal way, not straining too much. That's a simple thing. If you are doing a normal aerobic something, do with a chair sitting position. Don't go for vigorous aerobics. If you have people are walking and all, you can go for a walk, but not previous in a brisk walking. Go gently and little lesser distance. You should not feel very tired.
Oh,
and
yes, sir.
Prasad, can I add something?
Definitely, sure, sir.
During acute COVID period, when the oxygen saturation levels are decreasing, we can do one type of pulmonary physiotherapy, that is the patting with
Yes, sir.
open hand.
Yes,
In
sir.
Telugu we say charavadam, charusta.
Yes. Yes, sir.
Anteriorly, alternatively, posteriorly. If
Yes.
you pat for 10 minutes, oxygen levels are increasing. It
Yes.
is the credit
That's
of pulmonary physiotherapy.
yes. Yes. PPT.
And proning.
Yes.
As you have shown one picture, fifth position,
Yes.
that is proning.
Yes.
In acute COVID cases, proning dramatically increased oxygen levels
Yes.
thanks to your physiotherapy.
Yes, sir.
Thank you.
Thank you, sir.
Your physiotherapy helped a lot in acute COVID cases.
We are mostly concentrated right now. This talk is on post-COVID, not acute, but little later. So I will not talk about that. Just physiotherapy.
Of course,
But that's which you told as the point, which is a valid point.
Give credit to your physiotherapy.
Thank you, sir.
సార్ కోవిడ్ వచ్చిన తర్వాత బ్రీతింగ్ ఎక్సర్సైజ్ ఎన్ని రోజులు చేయాలి సార్?
బ్రీతింగ్ ఎక్సర్సైజ్ ఎన్నిలో చేయాలి, ఇట్స్ నాట్ ఇది పీరియడ్ ఆఫ్ చేయాలి, ఇన్ని రోజులు చేయాలి అని కాదండి. మీకు అట్లీస్ట్ మినిమం 3 to 6 months ఈ ఇష్యూస్ కనబడుతున్నాయి. మినిమం 3 to 6 months చేస్తూ తర్వాత కూడా చేసుకున్న నష్టం లేదు. అకౌంట్ ద పేషెంట్స్ ఆర్ పర్సన్స్ దేర్ ఇంప్రూవ్మెంట్.
Can you elaborate on active cycle breathing techniques?
Accurate. This ACBT wants say one of my physio to demonstrate that. Sandeep.
Yes, sir. Yes, sir. Hello, everyone. I'm here to demonstrate ACBT, which is abbreviated as active cycle of breathing technique. It have 4 phases, 3 phases. Like one is breathing control, second one is deep breathing, and third one is huff or cough. In the breathing control, we just I will demonstrate you. There's a gentle breathing technique. Position yourself in a relaxed position. Like take a normal breath, gentle breathing. Later on, after 3 to 4 times, go to deep breath. This is like this deep breathing phase will be like 3 to 4 times. If the patient, if any people are feeling like dizziness, again please go back to breathing control to just relax, to maintain your relaxed breathing, and again go to breathing control phase again 3 to 4 times, and come again back to deep breathing phase. Take a deep breath through nose and exhale through mouth. Control your breathing with breathing control again. Now let's go to the last phase, which this phase is huff or cough. Let me demonstrate how huff is. Take a deep breath. This is huff, which is when you're taking the deep breath, hold it for 3 seconds, and open your mouth with the help of your stomach muscles and chest muscles. Just expel out. This is huff. And another one is cough. See, this is cough technique, and these both techniques, huffing and coughing, these techniques you will be useful to drain your secretions out. Again we'll go to breathing control. Now you'll be relaxed, and if you want to do it again, and start with breathing control again, and again deep breathing, and again deep breathing exercise, and again breathing control, and then huff or cough. That's it. If any doubts, I can demonstrate it again.
Thank you, Sandeep. That was the demonstration of ACBT.
How do you plan physiotherapy among COVID positive patients and post-COVID recovery?
Like,
During COVID infection and post-COVID infection also.
yeah. During COVID infection, maybe if they are hospitalized, that will be a different thing. They'll be looking into chest clearance part, most of the and oxygen saturation to improve the positioning. If it is people are not on hospital admission, or that are at home on basic medications, they can do breathing, which I've already spoken, which I've told all the previous classes. You can do a breathing control exercises in minimal way, using that score of breathlessness, not to strain too much, and make sure you do exercise every day a little bit, not too much. That exercise shows very good impact and significant improvement of COVID-19, along with the medications and along with your good diet. So exercise is very important, but if the exercise doing too much is also a problem. So no vigorous exercise advised. Make sure you take adequate rest in between the exercise sessions you do. So maybe you can plan 2 to 3 times a day, not too much, and make sure you are ventilated well and do that exercise. That will help you out. If you're on the post recovery, if you are all out of all the medications and all, you can do little bit more than that. The number of times can be increased, or you can add on with muscle strengthening exercises, range of motion exercises, a little bit aerobic exercises, which are according to your fitness level. So that's the one thing you can do. If you are on most of the oxygen therapy too much, given in the hospital, if you are impaired with cognitive issues and memory issues, those those things can be taken care according to your issues. Maybe a psychiatrist or a psychologist or physiotherapy or occupational therapy, according to the necessary you have, you can consult them and get advice.
Can you add a note on breathlessness scale assessment, sir?
A breathlessness scale, yeah, I sure I'll get it. This is which I put it as very common because I wanted everybody to understand it. So I put it in a very simple way. This is score out of 10, which is like it says 0 is nothing. You can say till 1, it's like very, very light, very slight. In a sense, breathlessness means which you feel your little discomfort, like breathing issues. You're having breathing problems. You feel like you're taking too many breaths, or you're feeling discomfort taking the air in and leaving it out. So in that way, you scale it out. Is it very light problem, or little moderate, or little severe, or very severe? So that way we score it. So 0 to 1 is very, very mild and very light, and 2 to 4 is somewhat moderate to little. We graded severe to very severe, and 8 to 10 it's very utmost. So better not to go beyond 4. Make sure you are almost always lesser than grade 4. So it should be moderate level of breathlessness you should have. If you don't have any breathlessness, then there's no point of doing exercise as well. So you should feel little when you do exercise. It's usual, and it's good to have light breathlessness.
So, what are the exercises useful in improving cognitive skills, sir?
Cognitive skills make already I told those exercises which I have told. There are almost many types of things, but mostly we are seeing attention issues, or people having memory issues, or people having problem solving issues. Attention means like people are like you give them something, they don't do attentively. They will be like they don't see what exactly we are giving the work. Improve their attention. We give them different homeworks like programs, and make sure we get their attention and their concentration in a proper way. And secondly, memory, we see that their memory, how is it? We ask them to, we'll show something and ask them to remember it and then tell it again. Maybe a phone number, we can show some picture, some kind of colors, and tell them see. So in that way, we give them training, those memory issues. And we also can ask them some kind of picture, old picture, some photographic, and ask them, when is this taken? Maybe his birthday pic taken in last 5 years back. So we can take those picture and ask him, when is this taken? So like that, we can get his memory recovery, recalling back. Problem solving, we can give little calculative things. Maybe if they are more, they need calculations more, then we can give them calculations, or like their processing speed. Maybe we can put some kind of small solution to problems, mathematical or anything, and ask them to do a problem solving to solve it. Or we can give them a reasoning, some question, little small question, and ask what is it. So it's very good, easy, and we can give them in a basic manner according to their problem. Everybody will not have all type of issues, but whichever skill they have got a problem with, we train them.
Any physiotherapy Measures for good sleep in COVID-19, sir.
Like you want to improve your sleep.
Yes, sir.
As such, a sleep improvement, sleep matters a lot. That's maybe psychological issues, or most of the tense people after COVID-19, which they have seen is sleep disturbance. A lot of percentage also they have found out in journals. So sleep disturbance, I have not talked much because that I don't play a much role in it, but may really cognitive issues or psychological support and give them counseling and diverting their minds, whichever they have a problem. So those in that way we can improve their sleep. Maybe sleep disturbance if they have previously, not only because of the COVID-19, that should be attended with the psychiatric issues or psychological support. If only COVID-19, post COVID-19, they're having sleep issues, it may mostly it's a problem with their depression or their anxiety. Those are the major issues we need to look into and give them a proper counseling. So that should boost their recovery pattern and give them good sleep. That's what I feel. And exercise, maybe if you do a daily exercise, that can tire your body, but we don't want to do tire too much. So that also can give good sleep. But sleep as such, for sleep, I don't say we do a therapy for it.
Do you advise any relaxing positions that help COVID position?
Yeah, COVID-19 relaxed position, which I have shown some pictures. Uh, if you want, like people who are doing at home, there are different positions you have. You can do in sitting, or you can just to lean forward anywhere, wherever you are, maybe a chair or a table, or whichever. You lean forward so that you relax your muscles. So breathing air should be very easy. Normally, inspiration we take with some muscular assistance like diaphragm and external muscles. But if you have a problem with breathing, we don't want to take as too much of forced inspiration. We take it in a very cool way and ease the breathing manner. So we go forward leaning with some support. When you take a support, your muscle activation and the workload will be decreased. In that way, you can take the breathing in easy manner. So that's the one thing. If you are walking somewhere, just lean to somewhere, some wall or something. Just bend forward, and then you can take easy. If at all possible, you can do a lying, just lie down on the bed, side lying. You can put some pillows in the head end and elevate it. You can take a breathing relaxed position that way.
Why is breathing exercise important?
Breathing exercise important. That's a major thing because which I told that the three components or four components that are more involved are the effects that the post COVID-19 is. One is the muscle weakness. The second we see is the breathing issues, and thirdly the cognitive and the pain management. So one major part, mostly we can say around breathing issues around mostly more than 50% is people. They have even after the recovery of the COVID-19, they have the breathing issues or the lung issues, maybe any other lung related issues, not only because of the COVID. Previously, also people might have. So during after the COVID, that can worsen. So the breathing will basic exercise or basic thing for the patient to recover well. So breathing exercise is the most important thing in COVID-19 recovery for the patient. So and next comes the other exercise which we talked about muscle strengthening or any other cognitive issues. So that's a basic life support. You don't have a good air entry, then you might go for oxygen support again. So we don't need that. We don't want to go for oxygen support. We want our get the air in as much as possible to open up all the alveoli inside the lungs. So so that we don't get any other further complications like pneumonia or any other complications. So that's why we concentrate mostly on breathing exercise.
Okay, sir. Thank you.
One more question, sir.
Yes, sir.
So, what's the role of physiotherapy in maintenance of saturation?
Maintaining saturation. Saturation is the majorly like people or the COVID-19 issue. People who get little lesser than the 95 or 90, and that's a major problem. And in physiotherapy, it's not an acute. We don't involve in that, but in post recovery, you need to maintain the saturation for a good health. So maintaining saturation is like having a good air entry in the lungs and the air exchange, gas exchange happening in the lungs. So for that, we need to open every most of the part, in the sense every alveoli or the lung tissue should be ready, or it should be active. Not like no secretion should be in the lungs. The more the secretions in the lungs, then the saturation will come down. We don't want secretions to be in the lungs, so we want to clear the lungs secretions to improve the saturation. So in that way, we have given you a program. If I have secretions in the lungs, you can follow the technique which we taught ACBT, or you can do a different positioning for the secretions to come out, or you can try the breathing exercise regularly. So these things, in that way, you can remove the secretions out. So once your lung is clear enough, so then your secretion, your saturation will automatically be stable and it will be improved.
If the saturations fall below 93,
Yeah.
does physiotherapy have a role?
If you are 93, 90, maybe if they give an oxygen support, you can use those oxygen support as well. Using that, you can use the techniques which we have talked about, and you can try these techniques which we give not very vigorously, but in very gentle way, and you make sure you take in air as much as possible, keep ventilated. So in that way, you can increase the saturation levels. Once maybe at that time it may not give you good, very fast recovery, but later on, definitely it will wean off your oxygen support as early as possible.
Thank you so much, sir, for your valuable information and for your time also.
Yeah, thank you for watching this program, and I also thank HEALTHIFY for giving this opportunity. Thank you so much, and I advise, as the COVID-19 protocol, uh, wear mask, maintain distance, wash your hands regularly, and be safe. Thank you.
Thank you so much.